capsular tightness is associated very commonly with, well, frozen shoulder is adhesive capsulitis, so it's the whole capsule. Posterior capsular tightness is associated with overarm sporting injuries or overarm sporting
So like your bowlers.
techniques, like throwing, yes, like volleyball hitting, tennis. Why? What is the mechanics and the action of the external rotators in overhead sports? When are they most working and working the hardest? When they are
in shortened.
Internal rotation.
decelerating the shoulder. They're external rotators. So when you throw, to stabilize that arm and that shoulder joint, the external rotators are lengthening.
Yeah.
Lengthening into medial rotation.
Yeah.
Eccentric activity,
Would
which
that
is
be the same as swimming?
yes, but different, because
No, you're not
the
decelerating, are you?
correct. You're not. It's not a. What's the word I'm looking for? There's a speed difference
There's a
in the
constant
control.
resistance as
Yes.
well, isn't there?
Yeah.
And then you're trying to slow down, otherwise you're going to fall over.
Exactly. So the speed of the eccentric control of the external rotators in throwing, in hitting, in serving, in not so much bowling, it's more of a concentric thing, is so much more. It's like that you have to, whereas in swimming it's
The speed.
like it's a different activity.
Yeah.
So what happens in your overhead speed activities is that the infraspinatus teres minor work a lot harder and a lot faster in eccentric control, and because they're attached to the posterior capsule, you get posterior capsular thickening secondary to other rotator cuff issues.
Okay.
And what that does when the posterior capsule thickens and tightens, it pushes the humeral head forward into anterior position,
Yeah.
which can lead to anterior instability,
Yeah.
okay, which can then lead to secondary rotator cuff or supraspinatus tendonitis, which can, with trauma,
Bless you.
easily then lead to subluxation or dislocation anteriorly, okay?
Okay.
Because the humeral head and the capsule and this capsule at the back is tightening,
Yeah.
and because when it tightens, it pushes the humeral head further forward. It
And then all the
translates
ligaments
it
and everything else
subtly
stretched.
further forward.
Yeah.
Yeah. So we want to then treat and release the infraspinatus teres minor muscles and the insertion of those two muscles into the posterior capsule. And the posterior capsule we're talking about on the joint line, and the joint line is there. We're not needling into the joint. Okay? We're needling blindly, I must admit, through deltoid and into the tendon and tenocapsular interface of the shoulder joint. And there, by that, we're guided by the patient's signs and symptoms. And then what we're also going to do for that patient is you're going to strengthen and you're going to stretch the posterior capsule. And to stretch the posterior capsule, you get the patient to lie on their posterior shoulder. So they lie on the scapula, and then they horizontally adduct the arm across. So you fix the scapula, and then you stretch the arm across, and you're getting that glenohumeral stretching. Because this is purely just rhomboid stretching. The scapula is moving across when you stretch like this, or when you lie on the shoulder like that, and you stretch like this, the scapula is fixed, and now you are stretching the glenohumeral joint. Okay.
What would happen if you went into the joint? The synovial fluid would
Nothing. No. We don't needle into the joint because number one, the muscles are not in the joint, and number two, we don't want to potentially cause joint infection. Potentially. And so we have there is no reason to needle into the joint. Okay.
Yeah, but when you have like adhesive capsulitis,
Yes.
so it's fibrosis, digestive fibrosis,
Yeah.
you want to improve the blood flow in there. You want to just
Sure.
make it more flexible.
Yeah.
So why you wouldn't go with the needle inside? I mean,
Well, you can-
some people, some therapists,
Yes.
they do this.
Yes,
they
they
go
do.
with the needles inside the
Yeah.
joint.
Yeah.
Why wouldn't you go there?
For those exact reasons that I just said, that you could maybe cause infection.
Yeah.
You could maybe. When you go for an aspiration or a joint injection, the doctor will clean and disinfect around
All over.
the joint quite extensively before he sticks the needle into the joint and takes the hemorrhagosis or the infusion out or injects into the joint. For sterility and to avoid infection.
But at the same time, you can cause into the muscle, same thing, isn't it? What will be different?
Potentially, but the joint, we could cause an infection to Leah today, all right? If we
Yeah.
had bad, if we used the old needle, if my hands had too many germs, and she got really unlucky, and we needled her, and we caused an infection.